shook your hands, but
Hi, Rich.
welcome again.
Thank you.
Yeah,
Hi, Rich McKay. Hi, Denise. Nice meeting you.
Okay,
welcome
there
again.
you go.
Nice to meet you, Rich McKay.
I'm Mayor Ken Tedford, and I'd like to call the meeting of the Central Nevada Health District to order. All stand and pledge allegiance to the flag. Thank you.
Can we just pause 1 second? so
You
we
sure
have
can
a-
pause 1 second.
Sorry. So if you scroll down here, this will actually take you to each item.
Gotcha.
And so you can actually go to the consent. When it goes down, because then it'll actually
Yeah.
do the motions in the full packet.
We'll find out how the second half goes.
That's okay.
Usually we have someone show you guys how to do this.
Sometimes I have to watch a movie and
If your light is green here, that means you're live. Okay. And then all will show on screen. Thank you, sir.
you're sure welcome. Could you take roll, please?
Yes, go ahead and say present when your name is called. Chair Ken Tenford. Are you present?
I can't hear you.
Oh, go ahead and say present when I call your name. Chair Ken Tedford. Vice Chair Cassie Hall.
Present.
Jim Barbie.
Present.
Shannon Ernst.
Present.
Justin Heath. Not here. Bob Erickson, also not here. Denise Ferguson.
Present.
Tyson McBride.
Present.
Larry Rackley. Jeb Rowley.
Present.
And Rich McKay.
Present.
Item 4 on the agenda is for public comment. There's another one later on. Public comment must be general in nature, not relative to any item on the agenda today. Discussion can be held, but no decision can be made. Is there any public comment? Being no comment, we'll go to item 5, verification of the posting of the agenda.
Brittany Burton, for the record, the agenda was posted on the 7th day of July 2023 between the hours of 11 and 12 at all locations listed on the agenda in accordance with statutes.
Okay, thank you. We'll go to item 6, consideration and possible action to approve the agenda as submitted or revised. Do I have a motion to approve?
This is Shannon Ernst for the record. I make a motion to approve the agenda as submitted.
We have a motion. Do we have a second?
Tyson McBride, I second.
We have a motion, a second. All in favor?
Aye.
Aye.
Opposed? Being none, the motion carries and the agenda has been approved. We'll go to item 7, appointments, subsection A. Consideration and possible action concerning authorization for the Central Nevada Health District Administrator to sign an interlocal cooperative agreement between the State of Nevada Division of Environmental Protection and the Central Nevada Health District for services relating to public water systems from July 1st, 2023 through June 30th, 2025 for the amount of $0. Mr. Winkleman.
Mr. Chairman, members of the board, for the record, Darren Winkleman, Environmental Health Manager. The interlocal agreement before you creates the mechanism for us to partner with the Nevada Division of Environmental Protection regarding implementation of the Nevada revised statutes 445A 800 through 955, known as the Public Water Systems Law. The law establishes process and procedures for implementing inventories of public water systems, a program for conducting sanitary surveys of public water systems with priority given to systems not in compliance, and adequate procedures for the enforcement of state public water system regulations. Under NRS 445A 925, it is now the district's responsibility for enforcing the provisions of this law. However, since the program is new to the district and the state's budgetary timelines did not allow for them to build the funding into their budget for our implementation, we will partner with NDEP over the next 2 years to better understand the obligations for this program. During year one, we'll perform a workload analysis to determine workload and staffing needs. During year two, and most likely a little bit in year one as well, we'll participate in training, conduct and document joint sanitary surveys, provide assistance to ensure water systems comply with drinking water regulations, assist in preparing reports, and submit those reports quarterly to NDEP, and provide any administrative duties to ensure the program operates smoothly. We will meet with NDEP at least quarterly over the next 2 years to review the program needs and plan for the district implementation of the program starting July 1, 2025. This is a zero-cost interlocal agreement, and I believe we have NDEP representatives on the meeting if there are any specific questions about the program we can't answer. And Mr. Chairman, I will turn it back to you.
Okay, thank you. Are there any questions of the board? Any questions of the public? Being none, we'll go back to the board for a motion.
Mr. Chairman, Jim Barbie for the record. I would move to authorize the Central Nevada Health District Administrator to sign an interlocal cooperative agreement between the State of Nevada Division of Environmental Protection and the Central Nevada Health District for the period of July 1, 2023 to June 30th, 2025.
Do we have a second?
I'll second that motion. This is Denise.
We have a motion and a second. All in favor?
Aye.
None opposed? Motion carries, and we'll enter into that agreement. Thank you, Darren. We'll go to 7B. Consideration and possible action concerning approval of an interlocal agreement between the Nevada Division of Public Health and Behavioral Health and the Central Nevada Health District to perform food, water, and sewage inspections for the Burning Man project, including providing permits and inspections for approval of the interlocal agreement through September 3rd, 2023, for the amount of $0. Mr. Winkleman.
Thank you, Mr. Chairman, members of the board. For the record, my name is Darren Winkleman, Environmental Health Manager. The interlocal agreement before you creates the mechanism for us to partner with the State Division of Public and Behavioral Health so we can better understand how the division plans for, how they issue permits, and how they inspect during the Burning Man event. District staff will shadow the state during the event, as it will be important for us to understand this process, as we will assume the responsibilities for the event in 2024. As you are aware, the Burning Man event is held every year in the Black Rock Desert and consists of various events over a week or so period. This is a large, complex event, and the planning starts extremely early, well before we became a district on July 1. The district was not in operation during the pre-operational period when many of the permits are set up. The planning and logistics for this event could not wait for our start date of July 1, since there would only be approximately 55 days to initiate all planning. So the state has graciously agreed to continue to manage this event for this year. This is also a zero-cost interlocal agreement. With that, Mr. Chairman, I'll turn it back to you.
Okay, thank you. Are there any questions for Darren or from the public? If not, I'd entertain a motion.
For the record, Shannon Ernst will make the motion to approve the interlocal agreement between the Nevada Division of Public and Behavioral Health and the Central Nevada Health District to perform food, water, and sewage inspections for the Burning Man project, including providing permits and inspections from approval of the interlocal agreement through September 3rd of 2023 for the amount of $0.
Do we have a second? We have a motion and a second. All in favor?
Aye.
Aye.
None opposed? Motion carries, and we'll enter into that agreement. Thank you. Appreciate it.
Thank you, and you're more than welcome to attend the event with us. If you want to shadow, let me know.
I think I'll let you handle that. Thank you. Appreciate the offer. Item 8, old business. Item 8, old business, subsection A, consideration and possible action concerning approval to post the administrator job announcement August 1st, 2023 at a pay range 77. Mr. Gage.
Thank you, Mr. Chairman, members of the board. Caleb Cage for the record. This agenda item requests that we post the position, as you already noted, post the position for administrator and begin conducting interviews on August 1st, or post the position on August 1st and begin conducting interviews within 2 weeks after, and to bring viable candidates back for your consideration. As you can see on the agenda report, the posting is the same posting we've used before, the same job description rather, and the pay range would be pay range 77, which is the same pay range that we used before. I'll note that I will be out of the country for a part of August, and right after, if you agree to do this, right after this is posted. So interviews would be a little bit later in the month, but after the 2-week period if this is approved. So happy to answer any questions you may have, or discuss any items that you may need to address with this.
Are there any questions for Caleb from the board or from the public? If not, I'll entertain a motion.
For the record, Denise Ferguson, I motion to approve the posting of the administrator position on August 1st, 2023, with no revisions to the job description, and authorize the interim administrator to proceed with candidate interviews and update with top candidates at the following meetings.
Will you amend that to say at pay range 77?
Yes, with an amendment to include a pay rate up to pay rate of 77, pay range 77. Do you want me to start over?
No, it's
Okay.
perfect. You have that. It just wasn't in the recommended
that-
board action, but
It was
that's
in the
what's
agenda
on the
item.
agenda,
Okay.
so. Okay, is there a second to that?
Tyson McBride for the record. Second.
We have a motion and a second. All in favor?
Aye.
None opposed? Motion carries. Thank you, Caleb. Item 8B is consideration and possible action and authorization to release requests for the Food Advisory Committee members' applications as required by the Central Nevada Health District food regulations. You're back up, aren't you, Darren?
For the record, Darren Winkleman, Environmental Health Manager. As you're aware, we need to, based on the food regs that were approved by the board, establish a food advisory board. That board is designed to look at potential variances and waivers to the regulations that we have. So they will most likely meet periodically. We'd like to meet originally once the board is formed to kind of get the groundwork, the foundation of how the board's going to operate first. And after that, we don't see it operating too much. Certainly has some room for expansion in the future if that's the way we decide to go. We'd like approval to send out an invite letter along with the application to establish that advisory board.
Okay, any questions from the board or the public?
This is Tyson McBride for the record. Is this a volunteer position?
This would be a volunteer position, correct?
And does it, are they looking for anyone specific?
So it calls for 2 members from the food industry, 2 or more, 2 at least, and then it's a 7-member board, so 5 other members from around surrounding counties.
Okay, thank you.
I think the motion probably should be up in the subject title after authorization. That would parallel 8B on the agenda that was posted. Someone willing to make that motion?
For the record, Jim Barbie. Would move to approve, is this the right one? Would move to approve the application release of applications as presented.
Would you Jim, we willing to?
What would you like me to add to it?
Like authorization to release requests for Food Advisory Committee member apps as required by CNHD food
Will do.
regulations?
I would restate my motion to include, or to read as, I would move to authorize the release request for Food Advisory Committee members' applications as required by the CNHD food regulations.
Do we have a second to that motion, that amended motion?
For the record, Larry Rackley, I'll second that motion.
We have a motion and a second. All in favor?
Aye.
None opposed, motion carries, and we'll go to 9A. Consideration and possible action concerning approval to join the American Public Health Association for the amount of $525 per year. Caleb?
Thank you, Mr. Chairman, members of the board. Caleb Cage for the record. As was provided in the packet, this request is for $525 a year for the Central Nevada Health District to participate in the American Public Health Association. This allows for 1 to 20 members from Central Nevada, or this is the fee that is associated with organizations that are from 1 to 20 employees. So this is on a scale, and we would benefit from this by exposure to best practices and information from partner organizations around the country, and would be happy to answer any questions you may have from there, Mr. Chairman, or members of the board.
Is there any questions of the board or the public? It's a good idea. A real good idea. I'll entertain a motion that might state approval to join the American Public Health Association for the amount of $525 per year. Someone be willing to make that motion?
This is Shannon Ernst. I'll make the motion to approve joining the American Public Health Association for the amount of $525 per year.
Do we have a second?
Rich McKay for the record. I'll second it.
All in favor?
Aye.
Aye.
None opposed, motion carries, and we'll move to 9B. Consideration and possible action concerning Centus agreement to provide automated external defibrillator lease, AED lease, and maintenance to be provided at all locations at $816 a month.
Thank you, Mr. Chairman, members of the board. Caleb Cage for the record. As we've been building the health district, we've been taking into consideration our responsibility to members of the public and members of the staff and their safety as we are interacting and have offices open to the public in each of our locations throughout the district. We've engaged Centos to discuss the lease of AEDs, defibrillators, to have at the location. This includes maintenance and upkeep, and they've informed us that they're in all of the locations we are on a regular basis, so they're able to go out throughout all of the counties and provide updated equipment as necessary. The cost for 6 units is $136 each, or a monthly cost of $816 for a total of $9,792. We would also make sure that staff is trained and able to use these at the locations as necessary in the event that they are needed. Happy to answer any questions you may have, Mr. Chairman, or members of the board.
Any questions from the board or the public?
Question, Caleb, Rich McKay from Eureka County for the record. Have you identified any locations in Eureka County with these devices?
So we have looked at the 2 locations, the office facility in Eureka and in Crescent Valley, where these would be stored.
Okay. So you don't have anything to do with the ones in the school district?
No, we do not.
No.
Caleb Cage for the record.
These are pretty important devices. So a couple weeks ago at our 8th grade graduation in Eureka, a lady had a seizure, and they had one of these machines on hand, so for the EMS folks to use it, and it saved her life. She was flatlined, and they brought her back, and it was based on the use of this machine, so it's really a effective machine. So we'd be interested definitely, right, Jeb, and a couple for Eureka County.
Caleb, I think the only question I have is the comparison of a lease versus purchasing outright and having a vendor that really does the maintenance or repair. Like, did we evaluate any thoughts of purchase versus lease?
So Board Member Ernst has been involved in a lot of these conversations as well, and
So for the record, Shannon Ernst, so when we went into discussions over this, keep doing the lease allowed them to do the maintenance, plus they do the certification every month. So when you looked at the fact of Crescent Valley, they don't go to that area, so we have an extra one that clinical manager Desi Reeves would make sure they came in and we had a rotation. So every month they are getting checked and the certifications are maintained. After the 5-year period, you do own them, so then you can trade them in. But this guaranteed that they maintain that certification, the batteries are up, the pads, all the different things. And so that's why we really looked and recommended this option.
Okay, so it does have like a lease to purchase kind of option? Okay, perfect, thank you.
Once you purchase them after 5 years, then do they still go back and check them, or?
So I
Is that-
believe you could sign on to an additional maintenance agreement, but you would look at how much they'd been used. You know, you'd want to evaluate if you wanted to maintain the lease with that maintenance and the cost effectiveness at that point.
Because that sounds like that's the important part, is someone goes back and looks at them.
And I'll be honest, here in Churchill County, we have had AEDs for years. I worked with Pool to put them here, and that is the hardest part, making sure that the maintenance is up, the certification. And our maintenance team is doing that, which is not, I don't think always the best option. And so Centus is something we're evaluating also, like at the Life Center and other areas.
Yeah, because they're all around here. I wondered, you
They are,
make me
and they-
think whether like the ones we have around here are being checked.
So I know within the county admin buildings, the maintenance facility does that. And so when we were putting the MAB clinic together, you know, it was in making sure that you had a good one, and we had to trade out and they had to order new parts. And so this seemed like a better option to make sure that they maintain their certification and the maintenance at all times.
Don't we even have a lot of portables around here?
We do here in this building.
No, but I mean, don't we have them in work pickups? Don't we have portables?
I don't know that we do. I
I need to look into that, I think.
yeah, I don't know who has them of those.
Yeah, that maintenance just makes me wonder. Okay, thank you. All right, any other questions? If not, I'll entertain a motion on this.
Jim Barbie for the record. I would move to approve the CITUS agreement to provide automated extended defibrillators, before I screw that up, AED lease and maintenance to be provided at all locations at $816 a month.
We have a motion, do we have a second?
And
Go ahead, Jim, I'm sorry.
sorry, I wasn't quite done. And authorize, where did I lose it? And authorize the interim administrator to execute the contract.
Okay, we have motion, excuse me for stopping you there, Jim. Do we have a second?
Tyson McBride for the record, I second.
We have a motion and a second, all in favor?
Aye.
None opposed? Motion carries, and we'll enter into that agreement with Cintas. We'll go to 9C, consideration and possible action concerning ratification of Boost Lingo contract for interpretive services in the amount of $295 a month with a minimum commitment of 3 months. Caleb.
thank you, Mr. Chairman, members of the board, Caleb Cage for the record. Again, as we're moving forward with the establishment and the establishment process for the district, one of the things that we want to make sure we're able to do is to provide services to the communities we serve in the language preferred by the individual patient or client, depending on the service that is provided. We looked into a number of different ways of doing this, and I believe I believe that Boost Lingo was the service that was being used in Mineral County, but I'm not 100% sure about that. So this is certainly one that's been used throughout the state, and we have been working with them and looking into their services. As you can see from the board report, they have 13,000 medical trained interpreters, 24/7 access, and they serve in a number of different languages, which are included on the attached sheet as well. And this would really allow us to be able to provide uninterrupted services through this external resource for all clinic and other patients in the health district, irrespective of their preferred language. The fiscal impact of this is $3,245 a year, and that is essentially $295 a month for 10 months with a reduction for 2 months. Happy to answer any questions you may have, Mr. Chairman.
Okay, thank you. Any questions from the board or the public? If not, I'd entertain a motion.
Shannon Ernst for the record. I make the motion for the ratification for the agreement between Central Nevada Health District and Boostling Contract for interpretive services in the amount of $295 per month with a minimum commitment of 3 months.
Do we have a second?
For the record, Denise Ferguson, I'll second.
We have a motion, a second. All in favor?
Aye.
None opposed? The motion carries. We'll go to 10. See Ted here today. Are we going to just table his?
Mr. Chairman, I see one more
Oh,
item.
no, I'm sorry, we're on 9D. Sorry, Caleb. Consideration and possible action concerning ratification of an agreement between CNHD and the State of Nevada DPBH for funding agreement in the amount of $78,000 to provide special immunization outreach and administration from July 1st, 2023 through June 30th, 2024.
Thank you, Mr. Chairman, members of the board. Caleb Cage for the record. As the chairman noted under new business item D, we are asking for ratification and approval of receiving $78,000 that's broken out in the explanation of impact on your agenda report. We've been talking about for several months that we've been working on this subawards coming through as pass-through grants from the state, mostly through the Division of Public and Behavioral Health. And we're excited to say our first one has come through for a total of $78,000 in order to provide special immunization outreach within the district. This is one of, I think, a total of 17 pass-through grants that have been that we've been applying for. We are continuing to work with state partners to bring on more, but we are happy to bring this one in front of you and answer any questions that you may have on this or anything else needed to ratify this funding.
Okay, thank you, Caleb. Any questions from the board or from the public? If not, I'd entertain a motion.
Mr. Chairman, Jim Barbie for the record. I move the ratification of the agreement between CNHD and the State of Nevada DPBH for a funding agreement in the amount of $78,000 to provide special immunization outreach and administration from July 1, 2023 to June 30th, 2024.
Thank you. Do we have a second?
Jabaroli for the record, second.
We have a motion and a second. All in favor?
Aye.
None opposed? Motion carries, and we will ratify that agreement. Item 10, I still don't see Ted. So do we just
Yes.
table that till the next meeting?
Chairman Tedford,
Oh, you're out there in the virtual
I'm
land,
out.
Ted.
in the Zoom land.
Okay, go ahead then.
Dr. Ted McDonald for the record. Mr. Chairman, and committee members. I have provided you my report. There is no major changes from what I've presented. There are a few little things. The July 10th County Health Officers meeting was not held. And the CDC update is there is now an alert for measles in the United States, primarily from travelers from out of the country. Currently in the Central Nevada Health District, we are working on confirming staff competency with documentation for our lab and for our pharmacy certifications. On July 11th, the American Association of Family Practice presented to the advisory committee for the rural family practice residency program in Fallon, a discussion regarding the financial aspects of it. The organization is called the Residential Program Solutions. And the presenters were Louis Sanner and Kent Voorhees, MD. We will continue with that process. This is our first meeting with them, and they will report back to us as far as financial impacts of having a rural residency program. August 5th, 2023, University of Nevada School of Medicine will be working with us for a free clinic in Fallon, Nevada. And that's the update I have to those. Are there any questions that the board or the chairman may have for me?
Hey, Ted, what's the deal on malaria in Texas and Florida?
Okay, initially there was 5 outbreaks. There's now up to, I think it's 7, primarily in Florida. And these are outbreaks of malaria that are in areas that have in the past have outbreaks for malaria. And they're not from out of the country, they're localized, and in areas where they have species of mosquitoes that can carry malaria. So it's not an unusual thing, but it's one of those that we look at to watch, and for people to be aware when people present to an ER and they may have been from Florida or Texas or from areas out of the United States that have malaria, to be testing for them. Our past history with Fallon and our concern is that even though we've not had an outbreak of malaria, we do have species of mosquitoes that, given the right conditions, could present malaria. The reason why we hear more and more about this is because as we have these reports of climate changes, is there's a lot of parts of the United States that are becoming more like climates where malaria is more prevalent. So it's something that comes up that the CDC puts out so that the physicians are aware that they may consider malaria as a diagnosis of differentiation.
Is it in older people or younger people, or?
No, there's
Doesn't
no
matter?
age. No, it's exposure. It's like having the West Nile in Fallon, Nevada. It's not really dependent on if you're young or old. It's the exposure.
Thanks, Ted, and thanks for being on the TV screen.
Oh, you're very
However
welcome.
you say that. Any questions for Dr. McDonald? Okay, thank you.
You're
Appreciate
welcome.
it. We'll go to 11A then. Consideration and possible action on the Central Nevada Health District's Administrator's Report.
Thank you, Mr. Chairman, members of the board. Caleb Cage for the record. We've provided a report in your board packets, and won't go through it all, but hit some of the high points, and as always, happy to answer any questions you may have. As you all are aware, July 1st, was about 2 weeks ago now, and the Central Nevada Health District opened its doors and stood up operations. Because July 1st was a weekend, we did a soft opening on July 3rd, and during a holiday week as well. But we're really excited about the progress that has been made over the last 7 months since your first board meeting, and getting this established, and extremely grateful for all of your support and all of the support from all of the different partners and team members and others who've allowed this to happen. As you've heard throughout this presentation, or today's meeting rather, we've continued to work on putting all of the pieces together, whether that's providing safety and health equipment at the individual locations, or the necessary tools that we need, like the Boost Lingo contract you approved earlier, continuing to work with state partners on things like preparing for the Burning Man event, and to shadow them as well. Over the last few months, we've also been working very actively on hiring. I continue to serve as your interim administrator, with the new administrator position announcement being launched on August 1st, thanks to your vote today, as well as I understand you at the last meeting you met several of the managers, to include Desiree Reeves, Darren Winkleman, and Tiandra Rushing, who serve in very important management roles. Kathleen Peterson, the advanced practice registered nurse, will begin in August, and we're very excited to welcome her aboard as well. We continue to hire our support staff positions, and are continuing to interview for positions in the counties. We're having some success in bringing folks on board, and making some offers that the individual isn't able to meet, because they're not going to be living in the area as they had expected to, or otherwise. So we'll continue to work towards hiring out a full team. That'll be an ongoing process, as it always is, but we're very pleased with the amount of progress that we have made to date. Additionally, on July 1st, the Central Nevada Health District webpage was launched as well, which was approved, I think, in our February meeting to pursue work on this. Maybe the March meeting, working with Canyon Creative, they did a fantastic job. I took a screen capture of the landing page, or one of the pictures in the landing page. The link is also included, and we'll continue to build this out in the months ahead. But we wanted to make sure that on July 1st, when we were up and running, people knew that there was people had a place to go to online if they were looking for resources. So, like I said, we're continuing to work on bringing the environmental health pieces into this, the scheduling pieces, all of the different components. But for right now, the webpage is live. As noted previously, we have received, regarding funding support for the health district, we've received our first state pass-through grant, the $78,000 you ratified earlier, and we'll continue to work with the state in order to secure additional funding, but that's a significant source of revenue there. Also on July 1st, member districts began providing their support, their funding support for Central Nevada Health District, so we're continuing to receive those and monitor those resources as well in order to have operational funding. Not the news I was hoping to provide for you, but I've been updating you on 2 HRSA grants through DHHS to support health networks, and we were informed in late June that the Central Nevada Health District did not successfully compete for those, or was not approved for those 2 grants. So we will continue to identify federal competitive grant opportunities, and I think be more successful in the future. Hopefully, those would have been great for us operationally going forward, giving us some funding and some resources to do some community health needs assessments and things like that. But we were unsuccessful in both of those. And then finally, Senate Bill 118 was passed by the legislature, which will provide funding to the health district from the state for public health as well. And just as an announcement on that, I know you're all aware, but Governor Lombardo will be here on July 21st to do a ceremonial signing of Senate Bill 118 here, and we will reach out further with more information as we have it, but excited about that as well. So, Mr. Chairman, members of the board, happy to answer any additional questions you may have.
Okay, thank you. I know it's been fast and furious, and the staff has done a really great job, and they should be thanked for what they've done so far. Any questions of Caleb?
Hi, Caleb. I appreciate all of the work that you guys have done. I know a lot of it has been really continuing to move over the last 6 to 7 months. So I guess since it's just started as of July 1st, do we have any idea if there's any carryover from the workload prior to the start of 7-1 from the prior agencies or departments that might have had areas of coverage in our counties? Does that make sense, what I'm asking?
Caleb Cage, for the record, it doesn't. I apologize. Can you?
So
help me?
let's say there were waivers or applications for food or kitchen or anything. Is there anything carrying over from the prior responsibility that we now are responsible for? Or I'm just wondering if we've heard anything from those responsible parties prior to 71 that would then lean onto us, or are they going to be responsible for everything prior?
This is Caleb
I only
Cage.
bring this up because we have a kitchen at our casino that is still waiting for approval from a fire, to my knowledge. It's been waiting, and I don't know who's responsible for doing that. But I'm just bringing that up because I know they've been waiting for someone to go over and do that. I'm assuming from some health district prior to our inclusion on 7-1, and I just wonder if that's going to end up being our responsibility or if they're still going to take care of it.
Thank you for clarifying. I got there finally, so it took me a moment. But yes, I see Darren's joined us. Darren, did you want to provide any response to that?
Yeah, at least on the environmental health side, we did receive all of the facility list from the state health in terms of food establishments, pools, body decoration, those sorts of facilities. We do have a list of facilities that are in, I would say, maybe a little bit of non-compliance. At least the state felt they were in non-compliance, and so we're working to try to figure that out. We're also working to try to find out through our new database, that system where hopefully will come online, keeping our fingers crossed, 1st of August, and that will help us then begin to develop the permits. We have talked to several, or I've talked to several facilities that are anxious to get their permits, that they are either overdue or just about to come due. We're just kind of letting them know, hang tight, we're doing the best we can, and we've got them on the list. We'll make sure that we honor those permits that are there, and we'll get their new ones as soon as we can. So yeah, we're working through that. We do have that list. It's just been a little bit of a bumpy road trying to kind of navigate through it.
No, absolutely, and I would imagine it would have been nicer if it was just like the starting point and we went from that date forward. So I was just kind of wondering what that work burden would be for the health district and the employees that we were asking to complete it. So I appreciate that.
There's a difference between just the fault on this. Yeah. Gotta watch for that green light. There's a difference between someone who has a license that we just are gonna be behind on, why it all comes together, and someone who's waiting. Isn't there a way to like pierce that and find this restaurant and this casino and go look at it and get them going? You know, just find the name of whoever it is.
Cassie may know.
I think I might. This is Cassie Hall for the record. I can speak as a food industry business owner in Mineral County that we had more inspections than we needed to make sure we were compliant prior to the transition, and we received communication twice from the district that our transition would be seamless and not impacted. So we were very content with that process. As far as the casino's kitchen, I don't think they're finished. As of yesterday, there was a picture sent out publication-wise that their construction isn't even done, so I don't believe that they're
And
ready
I'm
for
happy to
that.
follow up with the manager. I think this was just at a chamber meeting, I heard. So I'll follow up with them just to clarify where their obstacle is, if it's really in anything that we can help them with, or if it's in something else.
Yeah, maybe Denise can find out and then contact you two and see if it's an issue or not yet for us to fix. Because we want to be in a, we're smaller now than the state, so we should be able to act a little faster than trying to call Carson City, who has the whole, whatever,
Yes, sir.
a lot bigger district than we were.
We'll follow up on that with you.
Okay, and I'll let Denise look into it and see. Okay, thank you.
Thank you.
We only got four counties here. Okay, good enough, good. Any other questions? If not, we'll go to item 12, consent items. Are there any consent items? Darren, thank you. 13, consideration of any future agenda items. Item 14, consider schedule future meetings. I think it's August 10th at 1:30, isn't it?
August 10th at 1:30, yes.
And it'll be here. And item 15 is the second time on the agenda for public comments, general in nature, not relative to anything on the agenda today. Discussion can be held, but no decision can be made. Is there any public comments?
Mr. Chairman?
Yes, sir.
Jim Barbie for the record. Two items to bring to the attention. First off, I'd like to acknowledge the passing of former Commissioner Carol Shank in Lovelock, and what a tremendous person and great lady she was, and she's truly going to be dearly missed and played a significant role in the early development of bringing this all together as a health district. So I wanted to do a hat tip to her. She's truly going to be missed. Then secondly, we would offer for those that are interested the opportunity immediately following this meeting to join us at 270 South Main, which is the building Churchill County's currently under escrow to be basically the location for the headquarters for Central Nevada Health District. To give you a tour of that building, we'll have the realtor meet us out there. This is the former furniture store in Fallon, Nevada, and it's a really neat building. So if you'd like to take that opportunity, just join us there in about 15 minutes, and we'll give a walkthrough of that facility. Thank you.
Well, why don't we just take a moment of silence for the commissioner? Okay, thank you. We'll go to item 16, which is adjournment. So there's nothing else. We stand adjourned. We'll meet again on August 10th at 1:30. Thank you all very much for coming today, and we appreciate all the hard work of staff that, and pass that along if you would, Caleb. Thank you.